Hello, my name's Courtney. I'm a paramedic student at the Dryden campus. I'm in my last year, so I'll be graduating this year. I'm doing my presentation on a medication called nitroglycerin, which is a medication that we use out in the field and the hospital uses as well. I'm going to go over the history, how it works in the body, why we use it, and what we use it for. So I hope you enjoy my presentation. So, starting out with the history of nitro, it was first made in 1847 by Asiano Sobrero. It was made of a mixture of glycerol, concentrated nitric, and sulfuric acids. There was a bad accident. His face got really scarred due to an explosion, and they considered nitro to be too dangerous to use as it was liable to explode without any warning, which is really dangerous. So there was a scientist named Alfred Nobel who studied these problems of the explosions and the dangerous things that can happen with nitro, and he worked really hard to improve nitro so they could use it for blasting rock and used in mining, which they were using it to blast rock cuts, etc. as well. In 1860s, he discovered that when it's combined with silica, it can be turned into a paste and kneaded into shapes, which is what dynamite is. So Sobrero actually tasted the nitro on his tongue, and that's when he realized that he got a severe headache from it, which was suggesting that it was vasodilating in his body, which created that headache. William Murrell experimented with the use of nitro to alleviate angina and reduce the blood pressure, and angina is what's caused before heart attack, and showed that the accompanying headaches was occurred as a result of an overdose of the nitro. Murrell began treating patients with it in small doses in 1878. So the classification of nitro in the pharmacology setting is it's an anti-angina, so it'll relieve the effects when people are feeling the angina, which is pain in their chest. It's a nitrate and it's also a vasodilator. So going over the pharmacodynamics of nitro, which is essentially the mechanism of action of the drug in the body. So the first one we'll go with anti-anginal action. So it's going to relax the smooth muscle, resulting in decreased myocardial oxygen consumption, which means that it's a decrease of the oxygen that the heart demands. It also works to dilate the coronary vessels, which helps move the blood to the ischemic tissues. So kind of get that oxygen flowing to the tissues that are dying from the heart attack that the person's experiencing. So the second pharmacodynamic would be the vasodilating action, and it works to dilate the peripheral vessels, which decreases the venous return to the heart. So it decreases the preload on the heart, and it also vasodilates the arteries, which decreases the afterload on the heart. So, going over the pharmacokinetics, which is essentially the movement of drugs within the body. So, it's available in many forms. It can come in a sublingual tablet, which goes underneath the tongue, as well as a sublingual spray underneath the tongue. And out in the field, as a paramedic, we actually use the sublingual spray. It comes in an aerosol solution, an extended release capsule, the transdermal patch, which a lot of people are prescribed these patches to put on. It comes in an ointment, and it can also be injected through an IV by a healthcare provider, but that's usually only used within the hospital. So still going with the pharmacokinetics, the sublingual spray, which is what we use, so I'll focus more on that. It has an onset of 1 to 3 minutes, so once it's put underneath the tongue, it will work within 1 to 3 minutes. The peak life is actually unknown, so nobody has really been able to figure out the peak of it. The half-life is 1 to 4 minutes, and the duration is 30 minutes. So why we use it pre-hospital as a paramedic, we use it when people are experiencing angina, so when they have a lot of pain from their heart attack, We will give them some as well as we'll give ASA, also known as aspirin. And we also use it with acute cardiogenic pulmonary edema, which, to simplify that, that's a fluid in the lungs backed up from the heart when the heart's not pumping properly. Another use for nitro is for hypertension. We don't use it specifically for that in the field, but it does treat high blood pressures. It's not used to treat chronic primary or secondary hypertension, but nitro is used to lower blood pressure in acute hypertensive emergencies that can result from a pheochromocytoma, which is also known as an adrenal gland tumor, a renal artery stenosis, or an aortic dissection. It's used during surgery to control the arterial pressure, but again, that's only in the hospital that it's used for that. So nitro is also used for heart failure. It's used in acute heart failure and in severe chronic heart failure. Arterial dilation reduces the afterload on the failing ventricle, and it leads to an increase in stroke volume and ejection fraction. Venous dilation reduces the venous pressure, which helps to reduce edema, so that's such as like swelling in the legs. Reducing both afterload and the preload on the heart helps to improve the mechanical efficiency of dilated hearts. And it also reduces the heart wall stress and the oxygen demands placed on the failing heart. So when the heart's not working properly, it's demanding more and more oxygen, and the nitro helps get more oxygen to the heart. So as a paramedic, we use nitro for acute cardiogenic pulmonary edema. Nitro works to decrease the preload on the heart. It also works to decrease the afterload in high amounts of it when it's given. And administering nitro can be life-saving for this patient. So when we're giving it for acute cardiogenic pulmonary edema, we can only give it if somebody is in moderate to severe respiratory distress and we have to suspect that they're suffering from acute cardiogenic pulmonary edema. So a big history of a cardiac history, maybe congestive heart failure. They need to be 18 years or older. Their heart rate actually needs to be within the parameters of 60 and 159, and their blood pressure needs to be over 100 systolic. We can't give it if they have an allergy or sensitivity, obviously. They can't have used phosphodiesterates within the previous 48 hours, which are essentially erectile dysfunction drugs. And their blood pressure can't drop by 1/3, and if it does, we have to discontinue using it. So the dosing of acute cardiogenic pulmonary edema, if their blood pressure is between 100 and 140, and they have a history of using it, or if there's an IV established, we can give 0.4 milligrams sprayed underneath the tongue, and we can give that 6 times every 5 minutes. They need to have that IV established in case their blood pressure does drop, because nitro does have the vasodilating effects, which helps to drop the blood pressure. And so if they don't have a history of it, they need to have a blood pressure starting off over 140 systolic, and they as well get 0.4 milligrams every 5 minutes to a maximum of 6 doses. But if they have a history, or if there's an IV established and their blood pressure is over 140, we can give 2 sprays, which is 0.8 milligrams, and again, every 5 minutes and to a maximum of 6 doses. So moving on to when we use it for cardiac ischemia, which is essentially angina. So we treat angina and myocardial infarctions with it. It helps to relieve the pain significantly. It's useful for Prinzmetal's angina because it improves the coronary blood flow and it increases the oxygen supply by reversing coronary vasospasms. So it helps other forms of angina because it reduces the preload on the heart by producing the venous dilation, which decreases the myocardial oxygen demand. And it improves the oxygen supply and demand ratio, which helps to reduce angina pain. So they experience that angina because they're not getting enough oxygen to their heart, and this really helps to reverse that and relieve that pain for them. So we can give it if we suspect this to be cardiac ischemia. They need to be 18 years or older. They cannot be altered. Their heart rate, again, still needs to be within that 60 to 159 parameter. Their systolic blood pressure has to be over 100, and they need to have a prior history of nitro, or there needs to be an IV established. So contraindications, again, allergy or sensitivity. They can't have that phosphodiesterate use within the previous 48 hours. And the reason for that is because phosphodiesterates, they dilate the vessels as well. So if they have that and nitro, that could be really bad by dilating the vessels a lot, and the blood pressure can essentially drop. And if systolic blood pressure drops by 1/3 after the administration, we will discontinue the use, as well as we'll need to take a 12 lead, which is basically a picture of the heart. And we need to look in the inferior leads and look for if there's any elevation in that, which indicates a heart attack or myocardial infarction. And we can't give it to those patients if they have that. So for patients with the cardiac ischemia, we can consider giving them nitro. If there's no ST elevation in their 12 lead, then we can give 6 doses of 0.4 milligrams. But if we do see any elevation, which is called a STEMI positive, we can only give 3 doses of the nitro. So the reason why we can't give nitro to those patients with the inferior STEMI, which is also known as a right ventricular infarction. The inferior ST elevation is associated with the right ventricular infarction. So the right ventricle is only responsible for pulmonary circulation, which has a lower pressure to begin with. Patients with a stunned right ventricle are dependent on that central venous pressure to maintain the cardiac output. So it can be really dangerous to give these patients the nitro. So in the hospital, how they can use it other than the spray that we use, they also use that, but they can also give it through an IV infusion, which they do this to treat the hypertension during surgery, so really high blood pressure. It's used to control congestive heart failure in patients who have had a previous heart attack. Sometimes used to treat angina in patients who have been treated with other medications that's not working for the patient. And it can also be used in patients with the renal or hepatic impairment. So, going over side effects of nitroglycerin, patients can really experience that hypotension, so their blood pressure is lowering. They can get a headache from the vasodilating effects. Sometimes they get nauseous, vomit, syncope, so pass out, the muscle twitching, flushing, or the reflex tachycardia. So just a couple points here. Don't use erectile dysfunction drugs with phosphodiesterate with nitrates because of the vasodilating effects. Using both can cause severe drops in blood pressure. So looking at alternate uses of nitro, so again, it can be used as an explosive. It's a heavy, colorless, oily, explosive liquid, most commonly produced by nitrating glycerol with white fuming nitric acid. It's used as an active ingredient in the manufacture of explosives, mostly dynamite, and as such, it is employed in the construction, demolition, and mining industries. So that's how they blow out rock cuts when they're building highways around them. This is just a funny picture that I found on the internet. Just kind of funny and ironic how they can use nitro for blowing things up in the construction industry, but we can also use it in the healthcare industry. But thank you guys for listening to my presentation. I hope you guys learned something from it. And if you have any questions, feel free to ask me or do some more research on it. It's a really neat medication and it works really well. So thank you.